Hi, I'm Dr. Ettie Ben-Shabat from Brain Rehab Academy, and in this video I want to show you how to use brain imaging to sort out the cause of confusion. It is important because sometimes when you see a confused patient, the clinical picture and the history could be rather complex and the confusion could be interpreted in multiple ways. By the end of this video, you'll have a system of 4 steps that will help you analyze information from various sources so that you can quickly understand what's going on with your patient and therefore how you need to treat them and how you need to guide other clinicians and carers around you. I will go through these 4 steps in a context of a case study, a case that a neuropsychologist brought to my attention a little while ago. The patient was a confused patient, which the confusion varied between days, so some days were more confused than others. The family or different family members were giving different information or different stories that were conflicting. And there was a question whether this person has depression or perhaps the confusion is new rather than old. And the neuropsychologist wanted to find out whether the brain images could help us make some of those decisions. Step number 1 was to look at the radiology report. And the radiology report said that there was a small subacute lesion, but other than that, there was no significant findings. The neuropsychologist didn't feel that this subacute lesion could explain the symptoms. So then step number 2 was looking at the brain images. And when we looked at the brain images, yes, the subacute lesion was quite small and not in a location that could explain the symptoms. But what we did see was that there were multiple small lesions, old small lesions all over the brain, including the medial temporal lobe. And this could indeed explain the reason for the confusion. The third step is about reconciling this information. See, it's like a puzzle that has different pieces of information, different pieces of puzzle that have to fit together to a coherent story, a coherent explanation. So the information from the family, information from clinical assessment, from radiology report, as well as from the imaging. And when you consider all those bits of information together, the presentation does not support delusion, instead it supports dementia. And the cause of the dementia is not the typical atrophy you would expect, for example, in Alzheimer's disease. Rather, it's related to those multiple small lesions. The fourth and final step is discussing your findings with the team. When you have the brain imaging information, it can really help you guide the team and answer some important questions. So for example, if we found in this particular case multiple small lesions that can explain dementia but not delusion, then you can say, I believe this is dementia and therefore it's likely to require some long-term management, care will be required in this case. Perhaps even ask questions to the neurologist and radiologist, what could cause those small lesions. In conclusion, this case study shows you how brain imaging can help you sort out the cause of confusion. When you understand what's going on, you are in a better position to have those kind of conversations, management conversations with the team, with the carers, with the medical doctors to see if there's anything else that can be done. If you like this video, please like and share, and I'd love to hear in the comments whether you had similar experiences with brain imaging and confusion. I look forward to seeing you next time. Bye.